Hello, and thanks for joining us. My name is Laurel. I am one of the account managers here at the Compliance Store. Today we are going to do a quick overview of the site. Our goals today are to show you the time-saving features and benefits built right into the system, as well as the diversity of the site. So let's get going. So what you see on your screen right now is the home page or the landing page. Once you log in, this is what you will see. Now, across the top are the tabs, and this is actually what houses the information on the site. We'll come back to that. The next area is our scrolling banner. So our scrolling banner, we do highlight maybe something new that we've created, something we've had to update based on regulatory change, or just something that is relevant going on out there in the regulatory world today. We're going to scroll down a little bit further. Document Cafe. So if you look at the green ribbon across the top, the very last area is the Document Cafe. This is an area of the site as a company or as a facility that you can house your approved documents. So if you were going to, change a policy, create an AMA form, you could even put in your care conference notes into the Document Cafe. But this is just an area of the site that you can house internal information from yourselves or from the site. Now we're going to scroll down a little bit further. We're going to start on the left-hand side. So the very first area is new right now. This is an area of the site where we house links to the most recent documents that we've added to the site. So you can see back on 9/9, CMS released an advanced copy of the survey process, critical element pathways impacted by Phase 3 guidance. So if this is something you're interested in or something you want to read more about, you can see that it's in a pretty blue print. Simply means it's a link. Just click on it. Now, there are two ways to look at documents on our site. What you're seeing right now, which is what we call the view only. So if you just want to read this over, make sure you get it. But if it's something that you need to save or something you need to share with coworkers, just go up here to the blue download, click it, and it will download that document. You can then save it to your documents or your desktop. All right, so we're going to go ahead and we're going to move over to the right-hand side. The very first area is called Hot Topics. What we house in Hot Topics are the most looked at or downloaded documents from our site. Now, I will tell you, we are a national company. We do have customers in all 50 states, including Alaska and Hawaii. But the most looked at right now is the MegaRule Phase 3 Policies and Tools list. So again, you can see it's in blue. We're just going to click on it. And for visual purposes today, you will see me download quite a few of these documents. It's just easier to look at in this format. All right, so these are the policies that we've written in regards to the updated Phase 3. So you can see all of these policies. Now, I will also tell you, even though these aren't in blue, they are linked. So if you wanted to look at the opioid overdose management policy, just go over here, click on it. It's going to pull that policy. Now, a couple of things about our policies. The very first thing is, let me pull this around, is that they are in a Word document. So if there's something that you need to add to this, be it a standard of practice, all of our policies are based on federal regulations. Maybe there is something a little more state specific that you need to add. You can absolutely do that because it is in a Word document. The other thing that I want to point out about all the documents, all of the policies that we write, and there are close to 600, is at the bottom of the page we cite our source, or we're going to give you references. So number one, we're going to tell you why did we write it. And again, this was based off of FTAG 697 and that update, and where the information came from. It came from the Substance Abuse and Mental Health Services Administration. So, and again, the Medicare and Medicaid services. That way, if a surveyor ever questions, well, this is really nice that you have this policy, but why do you have this policy, and where did you get your information from? Again, we have cited that source at the bottom of all of our policies. All right, we're going to go back. We also have a tools list. So these are tools that we have created to help you be compliant with the regulations or with the updates to the Phase 3. So if you wanted to look at the QAPI facility, let's look at the focus calendar. We're going to click on that. And there you go. All right. So let's go ahead and go back to the home page. We're going to go down a little bit further, and the next area is a newsletter. Now, the newsletter is a very important part of your subscription to the Compliance Store. This is really what's going to keep you on top of what's going on out there in the regulatory world. Now, we do archive the last 3 months worth of newsletters. So let's look at, well, let's just look at this one. Now, with our newsletters, you will get an email reminder. We post this to the site every Tuesday morning around 8 a.m. Central Standard Time. You should get an email reminder. If you don't get that reminder, please check your junk or spam. Sometimes it will kick it back. If you're still not getting it, let your account manager know, and we can search it from our end. Now, we always have a top story for our newsletter. So be ready when October 24th arrives, October 24th being the date that you'll have to have everything in compliance with the Phase 3. Now, you'll also notice that we have embedded Blueprint in our newsletter. Again, those are links. So this is all based off of the QSO letter that came out on June 29th. So again, if it's something you want to read, you just click on it. All right, we're going to go back to the newsletter. We're going to scroll down a little bit further. Now, these are the weekly updates. Now, we do have a fully staffed research and development team here at the Compliance Store. And what they spend a majority of their time doing is just scouring hundreds and hundreds of websites to make sure we're bringing you the most up-to-date and accurate information. So, new information that came out from CMS that week. The flexibility to fight the COVID-19, emergency declaration blanket waivers. So again, new information from CDC, U.S. Department of Health and Human Services, new information from MDS 3.0, so the onboarding schedule for the transition for the IQIES. So all of that information came out that week, and we have it all on the site. We have new information from value-based purchasing, your QRP, or your quality reporting program. FDA, there were some recalls. So if this is something, and I'm going to go ahead and click on it, that you have in your facility, in your med rooms or your med carts, again, we're giving you the actual recall. So it's going to have your manufacturing dates, your distribution dates. That way, if this is something that you have in your facility, you can go ahead and make sure that you remove it from the med carts or the med rooms. All right, and at the very bottom of our newsletter, this is where we're going to let you know of anything new that we've created or anything that we've updated based on regulatory change. So once again, we did have to revise the COVID-19 vaccination policy in regards to the updated guidance. And we have also revised in accordance with the update to Appendix PP. So everything from arbitration compliance packet to the QAPI related FTAG guide, QAPI staff in-service training guide. So again, those are all documents that were were on the site that we had to update based on those changes. All right, let's go ahead and go back to the home page, and we're going to go ahead at the top and we're going to jump into our first tab. Again, we're going to go through this pretty quickly and really just kind of touch the tip of the iceberg, just making sure that you're aware of everything that's available to you. Under financial, this is where you're going to find your alternate payment models, your billing compliance, billing guides, CMS manuals, your QRP or your quality reporting program, and your value-based purchasing. So for example, we have all of your CMS manuals, everything from your Medicare benefits policy to your Medicare claims processing, your state Medicaid manual, your Medicaid program integrity, and your Medicare managed care manuals. If you go up and click on billing compliance, all of your audit standards are here. So your CERT, your MAC, your PEPR, your PERM. We're going to click on PEPR. And again, this is the information that it pulls. The user's guide for evaluating payment patterns, electronic report, the 10th edition, your distribution schedule. And we've even got an area here where you can actually re-download your PEPR system. All right, we're going to move into our next tab, which is government initiatives. Under this tab, This is where you're going to find your CMP reinvestment program. So if you remember back several years ago, when CMS decided to change our world, they did say that they were going to come up with some programs to help assist us in those changes. So when you click on this, you can see there's toolkits. The very first toolkit that they came out with are the competencies. And so CMS has written competencies for your administrator, your DON, your ADON, your CNAs, RNs, and LPNs. We have both the electronic and the paper version. And a little further along, we've also written competencies for all your other departments. But just know that these are the ones that CMS has written. All right, so we're going to go ahead and we're going to jump into the mega rule. We're going to go to phase 3. So the big focuses in phase 3 are going to be your compliance and ethics program, your QAPI and how you've integrated everything into your QAPI, training programs, so the competency component, making sure that the staff is understanding the information that they're being given, and again, trauma-informed care. I'm going to click on trauma-informed care. So you can see the resources that it pulls. We have a care solution, we have care plans, we have a training presentation. This was designed for you. It's done in a PowerPoint to give to your floor staff. We include the training handouts as well as the pre and post test. What I want to show you right now is the care solution. So what a care solution is, and we have, excuse me, quite a few on this slide. I believe there are 11 under various topics. But what a care solution is a one-stop shop for compliance. Trauma-informed care was one of the first ones that we created. So our care solutions, what we do is we just explain to you why. What happened, what changed, why do you have to be compliant with this? We're going to give you potential FTAGs you could be cited for. We're going to include a policy. So again, if you wanted to read this policy, just click on it. Some type of an assessment form. So for this one, the PTSD checklist for the DSM-5 is an extremely comprehensive assessment form. And honestly, there was no point in recreating that wheel, so we included it in our care solution. And then we tie it all together with a care plan. All right, we're going to move into our next category, which is our ICD category. Under this category, this is where you're going to find your healthcare common procedure coding system, your NCCI coding manual, and your ICD-10. We're going to click on ICD-10. We're going to click on code sets. Now, back in June, they did come out with the fiscal year of 2023 code sets. So your external cause of injuries, your alphabetical index to diseases, official guidelines for coding and reporting, your tabular list of disease and injuries, all right, we're going to move into our next category, which is MDS. Under this category, this is where you're going to find your RAI manual, your appendices, CASPER user guide, keeping in mind that that's going away, data specifications, your IQIES, payment information, so your PDPM and your RUGs, your provider user guide, quality measures, and supplemental documents. Now, whenever you see supplemental documents under a department or under a specific category, just know what we have there are supporting documents for either that department or that category. So under MDS, you're going to find your overscheduling tools, your Section GG job aids. So let's do this. You're also going to find things like your assessment typing and combination tables, performance, and I never say that right, you'll know. So again, just supporting documents for the category. All right, we are going to go up to the IQIES. Just so you know, this did come out on 8/18, so we do have the user's manual already on the site. So those are all there, as well as the onboarding guide, the job aids, onboarding schedule for your MDS transition. All right, so let's click on the RAI. Now, what I want you to know is that what we do with most all of the manuals on the site is we break them down for you. And that's just simply to save you time. So let's go to Chapter 4. Now, Chapter 4 is 45 pages. 45 pages? Yeah, 45 pages long. You know, that's not huge, but it's still a lot of information to scroll through to find exactly what you're looking for. So you'll notice bookmarks to the left. We're going to go down to the 20 care areas. Click on that. It's going to take you right to the beginning of that information. Again, just a time-saving feature we've built right in. All right, we're going to move into our next category, which is regulatory agencies. Under this category, this is where we house information from the agencies that regulate what we do on a day-to-day basis. The nice thing is it's pre-filtered, so it is specific to our industry. Our categories are CDC, CMS, Congress, Drug Enforcement Agency, Department of Justice, Department of Labor, the FDA, Government Accountability, U.S. Department of Health and Human Services, HIPAA, MedPAC, the National Institute of Health, Office of Inspector General, the ONC, and Substance and Mental Health Services Administration. Now, I'm going to tie this back into the trauma-informed care. So let's just say you've done all of your assessments and you find out that you have 5 or 6 residents who trigger for trauma. This is a great place to go into for tools for that. You're going to find the AIM scale is located here. But there's also a lot of stuff to support education, whether it be for someone who's triggered for trauma, for the family, for the resident themselves, coping with disaster or traumatic event. There's a lot of great stuff here. These are things that you can utilize if you provide education for your family night, if you're looking for a topic for your newsletter. And again, you can see there are 2 pages of documents listed here. All right, we're going to go back over here to our categories. Let's do the FDA. So under this category, just so you know, we do house the food code, as well as information on drugs and biologicals, food, medical devices, and recalls and notices. Now, remember in the newsletter, when we clicked on the recall, let's go back. Make sure I pull the right one. Here we go. So here is the one that I pulled. Now, let's say you're doing mock survey or you're just doing some basic standard survey prep, and you come across something in your med room and you say, I think there was a recall on this. This is the area of the site that you would go to research that. All right, we're going to do Department of Labor and Human Resources, just so that you are aware. We do have your EEOC forms, your I-9 forms, your FMLA. So we're going to click on Family Medical Leave. We're going to do forms and posters. So back in 2020, they did update the FMLA submission forms. All right. So let's do the obvious, let's do CDC. So under the CDC, this is where you're going to find information from the CDC on antibiotic stewardship, C. diff, coronavirus, immunizations, influenza, Legionella, Legionnaire's disease, norovirus, the STEADY program. We have both the English and the Spanish-speaking version. Tuberculosis statements. I know a hot topic right now is the monkeypox. So we do have the updated VIS statement for that. All right, let's click on the obvious. Let's do coronavirus. Let's do some fact sheets and posters. Now, there is a lot of great stuff in here to support your vaccination efforts. So if you are like most of the nation right now, everybody's still in that hiring frenzy, trying to get staff onboarded. So there's a lot of great stuff in here to support that. Maybe you are bringing someone in from home, a new resident, which I know rarely happens anymore, and they've not been vaccinated. There's some great stuff in here. Maybe you have a lot of questions in regards to, you know, the boosters and all the new stuff that's coming out in regards to the boosters. Could be that you keep the symptoms poster posted in your facility. Again, this was updated on 8/12 of 2022, so you're going to want to make sure you have the most current symptoms poster posted in your facility. All right, we're going to move into our next tab, which is our safety tab. Under this tab, this is where you're going to find information from EPA, OSHA, and your emergency preparedness. So we're going to do emergency preparedness, forms and tools. Now, we also have a program on our site that is called Binder Basics. There are 12 Binder Basics, again, various topics. But what a Binder Basic is the nuts and bolts or structure of developing solid programs based on regulation in your facility. So this is what a Binder Basic looks like. We're going to give you an introduction. Why do you have to have an emergency preparedness program? We're going to talk about your commitment to preparedness, so the purpose of the program, the scope, program administration. Now, at the end of every chapter, we have an area called suggested documents. What that is, and again, you can see they're in blue, which means they are linked, are documents to support your program or documents for success. So if you wanted to look at the Emergency Preparedness Committee team charter, click on it. All right, so we're going to go in and we're going to talk about the risk assessment and the emergency plan. Again, we're going to find potential e-tags that you could be cited for non-compliance. We're going to talk about policies and procedures, so your disaster procedure, as well as your minimum requirements, again, based on those e-tags. Communication plan. We're going to talk about sheltering in place. You know, your decision making, your activation procedure. We're going to talk about evacuation. Your emergency response, so your incident command system, implementing that. Continuity of operations, so we're going to talk about post-disaster procedures, damage assessment and re-entry. Collaboration, so we're going to talk about the Healthcare Coalition. We're going to talk about formalized agreements, making sure that you keep those agreements, those transfers agreements updated. You know, I will just give you an example of that in the fact that when COVID hit, people have these transfer agreements. Well, down in the South, this is the time of year for hurricanes. It's also tornado season. So if you needed to evacuate, we had some folks who didn't update their transfers policies, and they were transferring folks into facilities that were not accepting active COVID cases. So it was a scramble to find a placement for those active COVID cases in their facility. And then we talk about testing and training. All right, let's move into our next category, which is state regulations. Again, we are a national company. We do house all 50 states. Assisted living and long-term care. I'm just going to do Alabama because it's the first one there. Now, the other thing that you can do on the site is you can do an internal search of the document. So if you go up to edit, go down to advanced search, a little box is going to pop up. Whoops, let's get a hold of that little box. And you can type in a search word. And what that will do is search the entire document for that search word. So I use the word abuse, and this is everywhere in the Alabama regulations where the word abuse is mentioned. Again, just a time-saving feature. All right, next category is survey and certification. This is where you're going to find your Appendix PP. your Appendix Q, your immediate jeopardy, Appendix Z, so all of those emergency tags or E-tags, your CLIA, your COVID-19 nursing home data, the Federal Registry, your 5-star, Life Safety Code, so your K-tags as well as your survey forms, the long-term care survey process, your QSO letters, your SOM or your state operational manual, transmittals, and Veterans Affairs information. Let's start with the long-term care survey process. So when you click on this, again, for example, under investigations, this is where you're going to find those critical element pathways. This is also where you're going to find, let's do facility entrance. So just so you're aware, we do have the 672 on the side, or your resident census and condition form. We also have your entrance conference worksheets. And I'm just going to pull this one, which is your focused infection control. So just letting you know that if it is an existing document on our site, and there's been an update, a regulatory change, just so you know, we do type that change in red. So for example, this was updated recently, and the most recent update to, if you should find yourself in a focused infection control survey, is that they want you to, in your entrance conference, provide a list of contracted companies that provide services for the facility, identify the name of the company, and whether the company provides direct care or non-direct care. So are they potentially agency staff that are coming in and helping, or are they somebody who's just coming in to fix the air conditioner or the elevator? They also want you to provide information on how the facility ensures that the contracted staff are compliant with the vaccination requirements. So again, that way that kind of takes the guesswork out of it. All right, Life Safety Code, again, all of your K-tags as well as your survey forms. So your 2786R, T, and V are all located on the site. Under the 5-star, this is where you're going to find your payroll-based journal, your special focus facility listings, your 5-star listings. Let's go ahead and jump into Appendix PP. So again, we do have all of your F tags on the site. So if there's a particular tag that you need to go in and research, this is where you go to do that. 561, again, this is effective October 24th. Now, one of the things that we've done, and we've done this with the F tags, the K tags, and the E tags, is we created a regulatory grouping chart. So all we did is we took all those tags and grouped them together by category. So your resident right tags, your resident assessment tags. Now, I realize this is not all in Blueprint. However, these are linked. So maybe you need to reread F tag 888, which is the vaccination tag. Just go down here, click on it. I'm going to pull that tag for you. All right. The other thing that I want to show you there under the F tags is if you remember back when COVID started, they decided that they were going to waive certain F tags for compliance. They are starting to rescind those waive tags. So if this is something you need to track, we do have a tracking form. All right. So the last area, one of the last things that I want to show you is the tools and templates. Now, what we house in the tools and templates category are things that we've created to help you be compliant with all the information in the previous tabs. We do have it broken down by department, so activities, administrative, environmental services, food and nutrition or dining services, HR, maintenance, MDS, nursing. We have a whole category for policies and procedures, social services, staff development, and survey management. When you click on survey management, So we have survey management tools. So if you do mock survey or you do basic standard survey prep, guys, there's a lot of great stuff in here. Everything from, here you go, a chart review for schizophrenic diagnosis. The FTAG 888 scope and severity grid. The phase 3 action plan, personnel file review. There's a lot of great stuff there. We also have created some immediate jeopardy removal plans. Hope you never have to click there, but if you do, we have some available. And we've also written some plans of correction. Now, I will tell you, we did not write a plan of correction for every FTAG. We took the top 45 most commonly cited FTAGs and created plans of correction. Let's do this one. So just want to show you what they look like. Again, in a Word format, obviously for obvious reasons. But the one that I opened is for FTAG 607, failure to follow policies and procedures regarding alleged violations. They're all done in the 4-step process. The immediate action taken, identifying other residents for potential risk or harm, the system you're going to put in place to reduce the future occurrence, and then how you're going to monitor that system. So all of our plans of correction come with a policy. This just happens to be a really long policy. They come with practice guides, a validation checklist, your in-service training guide, training and attendance form, and then a QA form or a monitoring piece. All right, we're going to go back to the categories. We're going to jump into staff development. So we have education on the site for the staff. So our topics include everything from abuse to active shooter, billing, bowel and bladder, cultural competencies, dementia. So for example, there are 16 modules of dementia training with pre and post tests. We have competencies. We talked a little bit about this earlier. These are the additional competencies that we've created. So we even have competencies for your contracted or agency LPNs and nurse aides. The dietary manager, just as an example. Again, topics for dietary sanitation, 5-star, non-pharmacological interventions, personal-centered care, respiratory care, survey training, tuberculosis, workplace safety. Again, a lot of topics of education on the site. Under social services, so again, forms and checklists. So again, these are supporting tools for the social services department. You're going to find everything from vet hold notices to behavior documentation, dementia abuse prevention posters, grievance logs, non-pharmacological interventions. Pass our level 2 tracking form. Now, under training, just so that you are aware, we've created some new stuff. We have the abuse, neglect, and exploitation, becoming a resident advocate, culturally competent care training presentation, as well as the trauma-informed care, end of life, resident aggression education, resident rights, suicide, supporting your LGBTQ. So again, that information is there. Next category, policies and procedures. I'm going to use the table of contents just a little bit easier to show you everything that we have to offer. So we've written some activity policies, administrative, and again, these are going to cover everything from abuse, neglect, and exploitation to illegal drug use, your QAPI policies, resident smoking policies, training policies. We have business office policies. These are going to cover admissions, resident personal funds, compliance and ethics policies, emergency preparedness, environmental services, food and nutrition. So these are going to cover everything from calibrating thermometers to food safety requirement policies, hot liquid safety. You have HIPAA, HR, absenteeism, light duty, illegal drug use, infection control policies. Now again, I know these aren't in blue, but they are linked. You can just click on them. Again, just saving you time from having to go in and out of documents to look at something that you're interested in. Now, the other thing to let you know about the policies is if we reference a tool with a policy, we always attach it. All right, we have IT policies. They're going to cover your social media policies, your password security policies, like safety code, maintenance. You have your MDS policies. We've already written the IQIES. We have clinical nursing policies. So again, these are going to cover everything from CPR with residents with suspected or confirmed COVID, pain management policies, tracheostomy care. You have medication management, destruction of unused medications, medical orders, medication storage, verbal order policies, nursing process policies. You've got wound management policies, social services policies, so this is where you're going to find your resident right policies, and some therapy policies. All right. So again, under nursing, this is where you're going to find your falls prevention program, your infection control program, your medication management program, pressure injuries, your restorative nursing, and again, those supplemental tools. So everything from bed rail use assessment forms to bowel and bladder assessment, daily staffing logs, elopement drill documentation, elopement prevention tips. You have MDS. So again, we have care plans as well as some high-risk medication care plans. So let's do antipsychotic. All right, let's jump up and look at administrative. Again, this is where you're going to find your compliance and ethics program, your emergency preparedness, your facility assessment, financial solutions, so solutions for billing and collections, your HIPAA security, your QAPI program, you've got quality measures and risk management. I'm going to click on risk management. I'm going to click on abuse. So we do have an abuse risk management forms packet. So again, just kind of a one-stop shop. So this is going to include your practice guide, your chart audit, your investigative protocols, your investigative statement, your action plan, and your summary. All right, last category is activities. So again, you're going to find everything here in regards to your volunteer program, your resident council, your quality reports, again, forms and assessments, so everything from lending library, book sign-outs, new activities, just a lot of good stuff there. Now, the last thing that I want to show you is what I call your safety net. If you go up to the blue ribbon above the green ribbon, there is a search bar. When you click on that, just so that you are aware, this actually searches the entire database. Now, it's not like Google. It really does, you really do need to use search words. And I'm going to use family, just because I was looking for some family night stuff and it wasn't where I thought it should be. So I typed in the word family and look at everything that pulls. Everything from family medical leave information to resident and family grievances, family council meetings, I mean, Family Dynamics Care Plan. Look at this. There are 8 pages of documents with the search word family in them. Now, if you still can't find what you're looking for, please reach out to your account manager. That's what we're here for. I do appreciate your time today, so I thank you very much. And again, we're looking forward to working with you.